Hello everyone. My name is Amanda Anderson and I am a current graduate student here at Liberty University. Today we will be talking about the anterior cruciate ligament. In order to visualize the location of the anterior cruciate ligament within the knee, we must first understand the structure of the knee joint. The knee joint encompasses three bones: the femur, the tibia, and the patella. The femur acts as our thigh bone, the tibia our shin bone, and the patella the kneecap. There are four ligaments within the knee: the medial collateral ligament, lateral collateral ligament, posterior cruciate ligament, and the anterior cruciate ligament. Today, we will focus our entire discussion on the anterior cruciate ligament. The overall function of a ligament is to stabilize the body component it's supporting. A ligament is made up of fibrous bands of connective tissue that join together two bones or hold together a joint, such as in the anterior and posterior cruciate ligaments within the knee. These ligaments form an X in the center of the knee to stabilize the joint. The anterior cruciate ligament also provides rotational stability and controls the back and forth motion of the knee. The ACL is composed of two fiber bundles. These fiber bundles connect the thigh and the leg. The larger fiber is the anteromedial fiber, which is located anteromedially on the tibial side, yet more proximal on the femoral side when compared to the posterolateral bundle. Below, in the picture, you can see the ACL is featured in blue. However, the anterior pic shows the anteromedial bundle in blue. Also featured is the posterolateral bundle and the posterior cruciate ligament. Biomechanics of the two bundles are as follows. The anteromedial bundle tightens when the knee is flexed, while the posterolateral bundle tightens while the anteromedial bundle relaxes. The bundle insertion points on the femur relate to each other during flex and extension. During extension, insertion points are vertical to each other, and when the knee is 90 degrees flexed, insertion points are horizontal to each other. Bundles shift from parallel orientation in extension to cross orientation in flexon. Athletes tearing their ACL ligament during sports is very common. This injury is seen in sports that require quick change in direction, jumping, and/or quick stops. Sports that have a plethora of ACL injuries include, but are not limited to, gymnastics, soccer, volleyball, tennis, and basketball. Signs of a possible ACL tear include hearing a pop sound after a quick knee movement, inability to bear weight on knee after jumping, severe pain and/or loss of range of motion. Featured here on the right-hand side is Derrick Rose, notably known as D Rose. In 2012, he tore his ACL in his left knee during the first round of the NBA playoffs against the 76ers. The season before this season, Derrick Rose was the most valuable player of the NBA. To this day, Derrick Rose still plays in the NBA, but he hasn't been as dominant as he once was. The most popular treatment for the torn ACL is a single bundle or double bundle reconstruction techniques. Both techniques are said to restore the native anatomy and mechanics of the joint and restore the tension pattern of each bundle. In the single bundle ACL reconstructive technique, surgeons use tendon graft to replace torn ACL. Graft is then placed in the position of the anterior medial bundle. The graft is held in place by a tunnel technique. Surgeons drill a tunnel in the femur and tibia, and the graft is held in the bone with a screw. In the double bundle ACL reconstructive method, two small grafts are needed to reconstruct the two ligaments. Two bone tunnels are also needed, and the procedure is longer and more complex. Researchers are split on which procedure produces the best results. However, the single bundle ACL reconstructive method is used the most because it's been around the longest. I'd like to conclude the end of my PowerPoint with a biblical connection. Ephesians 4:16 states, From him, the whole body is fitted and held together by every supporting ligament. And as each individual part does its work, the body grows and builds itself up in love. This Bible verse originally dates back to Paul discussing how the body of Christ is designed. In this statement, he is referring to all members of the church, although individuals, must come together as God intended for the church to continue to grow as a unit, heal, and save lives. In correlation to the body, as ligaments connect to bones and tendons attach the muscle to bone, all systems come together as a unit to maintain homeostasis within the human body, thus allowing us to continue to enjoy life, build relationships, and love one another. Thank you for taking time out your busy schedule to explore my PowerPoint. God bless you and your family.